Doctors in Boston say they've performed the first penis transplant in this country. The surgery performed last week on 64-year-old Thomas Manning.
Yes, so the surgery was performed last week on 64-year-old Thomas Manning, whose penis was partially removed due to cancer. The procedure took 15 hours using a penis from a deceased donor. Doctors say normal urination should be possible in just a couple of weeks, with sexual function possible in weeks to months.
San Antonio's Voice tonight. First, an apology for something unprofessional and unacceptable that one of our anchors did on the air right here at 5 o'clock today. He laughed during a very serious story, and I'm following up tonight with more than just an apology for that, because the story involved a medical breakthrough that has the promise to help thousands of people. But laughing about this one in any way just perpetuates a stigma that these patients should not have to deal with. And the anchor here, who was being stupid, immature, and unprofessional, was me. I'm sorry, and I have no excuse for it. The story had a word in it that maybe a 10-year-old would laugh at, and you might in a different context, but I should not have. Now, I snickered, you could say, when I read a story about Thomas Manning and the first penis transplant in the U.S. He's right there. I bring up my reaction because it's exactly the kind of thing that Manning has had to deal with before and probably will have to again, but shouldn't. Doctors shared the story of Manning today. He is the brave 64-year-old who underwent the transplant last week in Massachusetts. He had a workplace accident and then cancer. And he said he wants to come forward to show his face and talk about the transplant, which you might not expect in this case, because he knows this kind of surgery will help so many, and he wants to get the word out.
He wants to be whole again. He wants to not be, as Dr. Coe said, in the shadows and about an injury such as this. And that's really echoes what many patients with these kind of injuries feel like. It's something they can't even talk about, or they have difficulty even relating with their male friends or whomever. And it just stays quiet and makes them isolated and oftentimes very despondent.
Now, he and the doctor, they all hope this will help many cancer patients and wounded warriors down the road who've had to deal with all kinds of issues and stigma. I've done those stories, and I should know better. And on this very segment, I pointed out hypocrisy, stupidity, and mistakes by people who deserve to be called out. And today, I did deserve to be called out. And again, I'm sorry. So the next time you think of laughing at a word or maybe at someone, well, laugh at me in this teaching moment of why you shouldn't be stupid and insensitive. And remember people like Thomas Manning, who is really brave and can teach us all what real manhood is, and that laughter can sometimes be very hurtful.
San Antonio's most accurate forecast.